our coming here mainly is for three reasons. The first one, because we were looking at your statistics and we saw that you are having quite a number of patients with mental health. And we cannot, largely we know that this is a refugee. People are stressed, they moved away from their families, or they are here, they are away from their homes. That alone can be a big trigger for the mental health. But also what we have noted is that there is a tendency in this part of this area, it may not be specifically here in Kyaka, but in this whole area, not only just in this district, but quite a number of regions, we are seeing people embracing more drugs, especially amairungi. Mwagarebe nobuna ninyija nareba omuntu ariyo nabusitani nareba ariyo nafutana amatama gona garagara hariya haiguru hariya. So we are here really to look at the factors that are really accelerating the mental health issues in this especially in this camp. We know that the refugees alone, the refugee status increases the mental health vulnerability. But also we know that many people are getting into the habit of getting they're abusing substances. That is also increasing. I am intrigued to hear that 50% of the people who are coming with mental health, they have epilepsy. We need to establish, and I wish we could get more write-up, maybe the in charge. We need to get more analysis of the people who have epilepsy, 50%. What are the predisposing factors? Is it trauma? Is it drugs? Because drugs can cause convulsions, and then, but of course that one is not epilepsy, it is something else. But if it is real epilepsy, what is the cause? We need to know so that then we are able to mitigate. We know that you don't have a big facility to take care of the mental health, but I think that is something that we are going to discuss with UNHCR, because I think every refugee community, I think we need to have a proper mental health stuff, because we know that is the area that are prone. Our team, our population in refugee community are more prone to mental health. Even gender-based violence can trigger the mental. It can go into depression, and then because of depression, people opt to abuse, use drugs and all that. So I think these are things that we'll need more report on that, so that we can follow up. I think these big refugee communities will need really to have a well-established mental health, and then we can see how our mental health department, together with the referral hospital, can come and support and train, even if it means picking the nurses and doctors from here to rotate in the mental health, so that they get experience, because we may not get enough psychiatrists to post this way. We may not get enough clinical psychiatric officers, but at least we can get some officers. They can be oriented in some of those mental health. Then also we wanted to know whether the medical supplies for the mental health. If you don't have, I know because of the population, that is something that we may not really solve. Because even where I was, they were telling me they don't have medicine. So it is a general problem because of the population, and our budget is still small. But we want to thank UNHCR to come in to really make sure that they support. We want to thank you really, the doctors here, because I have understood here that you are well supervised and you are able to do ward rounds. You are doing ward rounds according to the doctor. Although I did to go there, I took you by your word, by faith. But Mugahe told me, who was here, that he witnessed it, that the doctors here are serious. Now, don't we need to benchmark? How? Don't we need to benchmark? Don't we need to benchmark also our the other doctors and clinical officers who are sleeping? They come here and they see how other people are working. This place is extremely heavy. You see, there are only 5 doctors, but they're able to do what round. They're able to, to make sure that everybody works, and they're here. They don't have even staff houses that are sufficient. Others you have had where they are sleeping, but they are here, they are working. What is different? In the same locality, in the same district, how can we, the other people are not working, here people are working in the refugee community? What is the difference? Why? Because these people are supervising, these people are holding people accountable. If I'm going to pay your salary, you must be able to work well. But ours, even if you don't work, your salary is assured. That must change. Now, this issue of disability, the services for this, because of the slope, I think that one, internally, you will see how to make sure that you create walkways that are supportive of these people with disability, because we may not come here to design the facility for you. I think internally management needs to see how to take care of those people.